back to it, guys. The Now Morning Show, where we continue to discuss the hot topics. Of course, vaccination is at the top of the list as across the country and the globe, we continue to implore people to get vaccinated. So this morning, joining me in studio, we have actual siblings who are both members of the Art Society of Mount Hope, that is, and medical students. So it's Fayleen Seechan and Farlon Seechan. As well as via Zoom, Dr. Vishi Beharry, Trinidad and Tobago Medical Association President. Lady and gentlemen, good morning and welcome.
Morning, everyone.
Now, what we are getting into is doing our part, because this trio of sorts, along with others, has been imploring people to do exactly that. I'm seeing these stickers, and that's the first thing I want to know about, because I don't have a sticker.
So this sticker was an initiative that we came up with in other parts of the country. Well, other countries, like normally when you get a vaccine, you'll be given a sticker to say, well, congrats, job well done, you are vaccinated now.
Got it.
So we wanted to employ the same idea at home here in Trinidad, and as well just do something for persons who got their vaccine. So we designed the stickers ourselves, and so far we have donated over 60,000 to all the health centers across Trinidad. So if you know anyone, you probably have seen the sticker around either on their card or just they have it stuck on their wallet. So it's a good initiative, and it's a good promotion as to go and get your vaccine, remind persons to get the vaccine, and it also shows you other persons who received their vaccine and be like, hey, if they got their vaccine, might as well I go and take mine as well.
Well, I know it's more than just the sticker, because what you guys have actually been doing is campaigning and, of course, volunteering your time as well. So before I get into the specifics of your roles in this, I do want to talk to Dr. Beharry, because when we talk about vaccination, we know how the government has been rolling out programs. But when we talk about volunteers, how hard or how easy was it to get these people going and giving up their time and energies to make sure that we're vaccinated, Dr. Beharry?
For having us on your show. I think it's a little bit difficult, but it's also a little bit easy. And I think that has to do with who is asking and what is the purpose of asking. We have had, together with the Art Society of Mount Hope, Mr. Seechan and Ms. Seechan there have worked with us as the Medical Association to get volunteers for vaccination drives across the country. A lot of the private sector mass vac sites we would have supplied volunteers to, most of them actually, and we were able to, over a period of 3.5 months, supply volunteers in the number of about 740 something in total. And these are unique volunteers who would have come at some point during the entire vaccination process, and we were involved in supplying volunteers to 5 out of the 7 private sector mass vac sites. The Diwali Nagar site being one of those run solely by NGOs, the TNT Medical Association and SEWA. And because of it being NGOs and NGOs like Mount Hope Art Society, Medical Association, there are people who are medical professionals who are members of these groups, even alumni members of the Mount Hope Art Society. That is to say, doctors who were a part of the Art Society when they were in medical school. We all have some sort of allegiance and support for the groups and organizations that help us become better at who we are in terms of healthcare professionals. And so we give back. And so a lot of these doctors would have given back to the Art Society in the sense of going to volunteer where they are going to volunteer. So Mr. Seechan has organized many medical students to support our initiatives at the private sector mass vac sites. In fact, I'm not sure if he told you, but he was actually appointed one of the assistants to the medical director at the Cooper Chamber mass vac site. And he did a sterling job at assisting that medical director in terms of managing that site over the period of time that they vaccinated more than 10,000 people for the few days that they had been open. So sometimes when there were more sites being open, there was a challenge in terms of getting adequate volunteers for each of the sites, but it all worked out in the end because these were all people who were coming willingly to give up their time, not seeking something in return, and really just wanting to support the initiative to vaccinate TNT.
Something we could certainly get behind. That sounds incredible. Now, Fayleen, tell me as much as possible what that entails, though. What does a volunteer do, besides, of course, having medical know-how?
Well, there were basically both medical and non-medical, so anybody could have volunteered.
Okay.
So it started from registration process, where we needed persons to help with the registration, the screening process, where we had like at least 20 screeners at each desk. Then we had vaccinators, and then we had assistants to fill out forms. We had the cleaners and people who were just assisting like the disabled persons and all of that.
You had ushers, you had everything from top to bottom.
It looks very easy. It looks like something, but it's a lot of planning. It's a lot of strategic and logistics that goes into it.
Tell me what that time frame of planning was like, because we had a small window between vaccinations coming in and then having to, enact. What was that like?
So sometimes we got it done like within a week, like probably 3 to 4 days, where we plan and we send out messages, we need the help, come and help.
Right.
And to do all the planning, setting up the sites and all of that.
Boy, it's off to you guys. But going back to you, we had as you said, the pleasure of being appointed. And one of the questions I often wondered is, with all of this information being disseminated, all of these persons being interacted with, there must be some level of data keeping that is being done, and I imagine an appointment of that sort might see you using that data in future. Is that something that the Medical Association is actually looking at?
Yes, actually, and the government actually, they do keep records of everything. So some persons may see the vaccination sites and think that, well, it's just chaotic, but it's organized chaos. Every single detail that happens, everything is properly documented, and everything is computerized.
Nice. Now, going back to you, Dr. Beharry, as far as the continued efforts go with coordinating and continuing to vaccinate, we will see a new phase coming into play when we start looking at younger persons being vaccinated. Will we expect, or should we expect rather, any sorts of changes towards these volunteer efforts or the entire process altogether?
I don't anticipate a change to the volunteer process. I mean, even though all of the private sector mass vac sites have been closed, the Medical Association has been called upon to assist once again in terms of vaccinations. And for the past 3 weekends, we have been supplying volunteers to to run and operate the UTT Chaguanas campus, which is one of the mass vac sites under the North Central Regional Health Authority. And occasionally on a weekend when they are short, we would supply volunteers to the SAPA mass vac site, which is under the Southwest Regional Health Authority. So this is an ongoing exercise for us, and we have continued to partner with groups like the Mount Hope Art Society, the Medical Students Association, SEWA International TT, to provide volunteers for these initiatives. Our aim really is to see as much as we can vaccinate TNT, as much as we can support the vaccination of TNT. So while we're doing this pro bono, we are not going to get into the discussion and the fight about who should be paid and who shouldn't be paid. We see a need that our country needs to be vaccinated, and this is where we are focused on support as much as we can until we reach herd immunity. We anticipate that once there is approval for a younger age group to be vaccinated, then there will be a spike in the amount of vaccinations being done, and we stand ready to support that spike.
Like it, you stand ready, and that's what we need to be. You guys are doing your part to make sure that we're doing exactly that. But if somebody wanted to continue to join the efforts, to volunteer as well, how can we do so?
So we are readily available on social media, Facebook, Instagram, so you could always follow us there and just DM us, and we'd be happy. We accept any help. Any help, no matter which background you come from, if you are medical, non-medical, what's your background, we take any help we could get.
Love it. And just before we wrap things up, I do want to ask individually, what keeps you motivated to do this job? Because it's not easy. And getting people vaccinated, as we see continuously in the discussion, is a touchy subject. What is the one message that you hope that volunteers, as well as persons who are getting vaccinated, come away with from these exercises and efforts?
We hope that there's a light at the end of the tunnel, that we could go back to a normal life. And I think vaccination is the way out.
Yeah, same as well. Like for the volunteers, every time we get up, we know it's a hard day ahead. But then when we finish at the end, we know we saved so many lives and we did our part in ending the pandemic, both us and the persons who got the vaccines.
Beautiful, beautiful. And on that note, I'm going to get my sticker. You guys are going to stick around, and we're going to continue to cover all the hot topics right here on the Now Morning Show. But when we come back, special surprise. We'll be back after this, guys.